Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting technologies from the world of health IT. I'm Colin Hung, and I'm here in Nashville, Tennessee at the 2023 MGMA Leaders Conference. And I'm about to meet up with Dr. Michael Blackman, Chief Medical Officer from Greenway Health. I always enjoy catching up with Dr. Blackman. He has always got some interesting perspectives, and I love his honesty. I wanted to catch up with him because I wanted to ask him about some of the new policies that are coming down from the ONC, and I also wanted to get his take on some of the interesting trends that I'm seeing and from a technology standpoint here in healthcare. So sit back, relax, and I hope you enjoy our conversation. Dr. Blackman, welcome back to the program.
Great to be here, Colin. Thanks for having me.
It's always fun to have you. I'm always excited to talk to you about some of the things you're seeing. And you were just mentioning to me that there's some new regulations on the horizon that you got your eye on.
Yeah, there are always new regulations on the horizon in healthcare. Go figure. But with the ONC coming out hopefully shortly with the HTI-1 rules, the final rule there, it'd be really nice to see what's happening when we start making plans for going forward. And that, for people who aren't familiar, that's really a change in the way the ONC, Office of National Coordinator, is approaching regulation. So as opposed to sort of being big chunks on a periodic basis, there's going to be still big but smaller pieces year after year after year. And we're always working. Obviously, we need to be completely compliant with all the rules, but we need to balance that against all of the other innovation that people want and frankly need.
Any clues as to what might be coming in this next round?
The best guess at the moment is we're certainly going to see more of the interoperability pieces, especially around US CDI versions 2 and 3 most likely. There's some other patient-directed pieces that may or may not make it. We'll see what happens there.
It is 2023, and I had to say this year you can't go to a conference or have a conversation without the word AI coming up.
No, not at all.
So tell me about what your take is on AI right now.
Yeah, no. So I think at some level people look at AI and say, "Oh, it is the next great panacea. That AI will do everything." I think we need to, at least in healthcare, sort of step back and say, where can we use AI effectively? Where is it safe? Certainly, there are a lot of routine things where it can be incredibly useful. If we look at patient correspondence, whether it's a school letter, a work note, following up on your labs. I think there are lots of things where it can be really good there. I think there is some possibility for decision support. I think it's a little further out as we go forward, because this is a place, and certainly if you look at things like ChatGPT, they have a tendency to hallucinate somewhat, and this is a place where hallucination just isn't acceptable. They just it has to be right. But I think we will see more of that. The other place where there's a lot of excitement is certainly around using AI-assisted documentation. I think that's a very big deal. One of the things that, historically, if you think about physician documentation, it serves two very divergent masters. One, it's a communication vehicle. What'd you do? What'd you think? Can the person that follows you understand what the next step would be or what you were thinking? The other master is a billing vehicle. Well, you can have a great billing vehicle that's an awful, communication vehicle, and you can have a great communication vehicle that's an awful billing vehicle.
Right.
And so hopefully we start bringing those two together, and to the best we can, make the note a byproduct of the work that's being done when we're getting closer. Versus an after event.
What I'm hearing from you is that the world isn't ready, or healthcare isn't really ready for the AI doctor, and I don't think the technology is there yet. But all the things that AI can do around the administrative side, the workflow side,
absolutely,
and the just making the processes so much smoother. That seems to me what you're saying is going to be.
I think that's where we are now, and I think as we go forward, I don't, and this isn't my line. I heard this from someone else, but I think it's right, which is, I don't think we're close to AI replacing doctors, but we're certainly going to see that doctors who use AI will do better than doctors who don't.
I love that. That is very apt for where we are currently. Mm-hmm. Anything around what you're hearing from customers in terms of the challenges that they're coming to you with? Anything that they're coming to you saying, boy, I wish Greenway could really help more with this, or can help me with this?
Yeah, I mean, we're constantly seeing it. It's the rate of change. It's what can Greenway do to help make the workflow more efficient because we have staffing issues.
Right.
How do we do the continual quest to do more with less? And as we look at the looming, the physician shortage in certain areas of the country, which is only predicted to get worse, how do we make it so people can be as efficient as possible while still providing quality care and taking off the administrative burden? And I think AI is a piece of how we're going to get there.
Dr. Blackman, always a pleasure to have you on the program. Where can people go to find more about Greenway?
Obviously, you can always go to greenwayhealth.com. That's a great place to start.
Awesome. Thank you so much for being on the program again.
No, thank you very much.
Always a pleasure to see you.
Good to see you, Colin.
Hey, I want to thank Dr. Blackman for coming on camera with me and for giving us his honest opinion on both the new policies that are coming through on the HTI-1 guidance, as well as his take on the pragmatic use of AI in healthcare. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com, where you'll find a lot of great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.